different heights here. So thank you very much. I'm very honored to be here, and I've been asked to present a little bit of my perspective on the innovation and technologies, and I think that conferences like this are very important because each one of us live in its own world, and then what happens is there's a lot going on, and many times the right hand doesn't know what the left hand is doing. An example of that is this iteration of this, and I apologize, the video system is not working, but we'll try to do something. But we did look, can we get this search web out of the way? Yeah, thank you. So this iteration of a bionic machine to be able to use endovascular procedures interventional, I have to go here. From a concept to actually realizing from that concept came to realizing this machine that permit us to look at multiple views, at multiple angles, and then take this information and create 3D images to permit us planning. And this is one of the 3D images that we can obtain. No. And what you can see actually is from these 3 images we can take soft tissue, we can bring it down, we can see the pathology. This happened to be a macrocystic lymphatic malformation and its relationship to the bony structures. So we can actually play with the windows to be able to plan treatment and to plan resection and getting more information with one acquisition. Going back to our presentation. Then we take the knowledge of anatomy, and this is a diagram that shows the difference between the anatomy in different people. If we look here, each one of us have an identifying face. We can tell one from one another. Our blood vessels are the same, except that when you go to school, they tell you the external carotid artery has 14 branches, and you have to memorize it, but it doesn't apply to the individual. Somebody's short, somebody's tall, somebody's skinny, somebody's fat. The same thing happened to the blood vessel. What is the constant is the foramina, for example, in the head and neck. So imagine Grand Central Station, which is a famous Grand Central Station in New York, is where all the trains come. So imagine the cavernous sinus region where the entrance of the blood vessels to the brain occur. So we can take that knowledge and then reconstruct from the periphery back to the center the anatomy. So we have technology that give us imaging. We have knowledge that we have to have, which is anatomy, without which we can't really do too much, and therefore we can treat cases like, for example, this child with a macrocystic lymphatic malformation, which used to be a tremendous surgery. Today, we can actually do percutaneous sclerotherapy and then remove some of the lymphatic fluid and then put different medications that I will show you in the keynote lectures to treat and get this kind of result without a scar. Technology has taken us to intrauterine imaging of this baby with a vein of Galen malformation. You see this large midline vein. So we know that prenatal. And then working with the neonatologists, again, the right hand, the left hand, our pediatric neonatologists are very familiar, as many of you in this room, is to put arterial lines through the 2 umbilical arteries and the umbilical vein. Well, we can actually take that knowledge and through the umbilical arteries navigate with this type of technology, that means microcatheters and different type of micro guide wires, be able to go through the umbilical artery into the aorta, from the aorta exchange to a better coaxial system, and then with that go into the brain. So we can actually go through the umbilical artery, into the carotid artery, and into the intracerebral arteries to deal with this very complicated vein of Galen malformation. And then another technology is using very famous material called crazy glue. And crazy glue, you know, the first one we did was in the early 80s out of hardware store. Today you cannot do that with the regulations that exist. But take, excuse me, microcatheters that were handmade, and then navigate inside to the brain and inject this under hypotension. So again, a good pediatric anesthesiologist has to give us hypotension and inject the NBCA, the glue, to close that malformation and be able to cure this disease. This is the scar, so everything is done. We can go into the brain through the umbilical artery. There will be the time we'll do this in utero. And this is the same child some years later, which comes up to a normal child. We can treat very difficult tumors, hypervascular tumors, like this hemangioendothelioma with Kasselbach-Merit syndrome, and be able to combine this with surgery and get this kind of results. I apologize, this is the same child. Then finally, we can go into the orbit and treat lesions of the orbit, vascular malformation of the orbit, and get this kind of results. So in summary, I think that it's crucial that the right hand talks to the left hand so that we can get these technologies in innovation and bring that information to our homes, whatever people from all over the world, and say there are techniques, there are development, there are technologies that can help my patients. Thank you very much.